Dr. Chudi Nduwaka was born and raised in Nigeria. After attending university in Nigeria, Dr. Nduwaka was fortunate enough to continue his education in the U.S., obtaining his Ph.D. in pharmacology. Although he currently works as a clinician for a major pharmaceutical company in Connecticut, Dr. Nduwaka realized that becoming a successful professional in the U.S. provided him the exposure and opportunity for him to fulfill his life's mission, to help the people of his homeland, Nigeria. Dr. Nduwaka believes strongly that with basic health care and educational assistance, any child in Africa can make their own dreams become a reality. The African Education Initiative, NEF, was created just for this purpose. With the help of volunteers and through donations from the health industry and educational institutions in the U.S. and Africa, NEF is making a difference for Africa's children by providing assistance in both education and health care.
These are going to the schools across Africa, Ghana, Liberia, Cameroon, and Nigeria.
During a recent trip back to Dr. Nduwaka's homeland of Nigeria, NEF sponsored a scientific conference at the Nnamdi Azikiwe University, Awuka Anabre State, Nigeria. During the conference, African students learned basic concepts in drug development and networked with other students and faculty from several countries in Africa.
The surrounding soil environment we found.
African scientists, faculty, and students received training in resume and grant writing techniques throughout the interactive sessions that took place during the three-day meeting. Among presenters was the U.S. team of NEF volunteers, Dr. David Blackwell, a toxicologist from Connecticut, and Dr. Jose Manitou, professor from the University of Connecticut. The team shared their expertise and encouraged the group of attendees to continue their pursuit of higher education.
You may do additional tests that may give you earlier signals or biomarkers that help you make better decisions internally.
The conference was a major success and was a strong indication that African students have the will, dedication, and strong work ethic to obtain higher education in order to complete degrees in science and engineering.
This is Nigeria. Welcome to Nigeria.
Although Nigeria is one of the fastest growing countries in the world, with a population over 130 million, a large percentage of these people are struggling with poverty, poor infrastructure, and a desperate need for basic health care. While in Lagos, the commercial capital of Nigeria, they witnessed the country's struggle to become an industrial nation and were inspired by the spirit of the local people. The trip also included a visit to Dr. Nduwaka's home village of Ovim, where the NEF has been providing health care to the community of about 23,000 people. NEF established a health care clinic in the center of the village, allowing villagers free access to doctors, nurses, and medication.
We started this clinic last year because in the area here, in the community, there was no available functional clinic to provide assistance and health care to the people of the Ovim community. The benefits have been tremendous. A lot of people have been seen in this clinic since November of 2006, and we still have many more people wanting to be seen. It is very important that we keep this clinic functional. It is costing us a lot of money to maintain the clinic, and we are hoping that corporations and individuals can help us with sustaining and maintaining this clinic. We have about 7 rooms in this clinic. The clinic is essentially an outpatient facility, acute care facility with a functional pharmacy. The next level is to get a functional laboratory in place. We hope that this will be achieved in the next few months. We also plan to upgrade this facility to have maternal care service, where pregnant mothers will come for their antenatal care and then have delivery here, which means that we would also have beds for admissions here. We've got on staff physicians from the National Youth Service Corps. We have nurses that help the doctors, and the nurses also take care of the patients here.
This one and these two.
One of these doctors is ophthalmologist Dr. Ebube. Dr. Ebube has been with the clinic for about 6 months and has been able to correct the vision of many patients that would otherwise go blind or live with poor eyesight.
So this very woman now, she has cataracts. So after surgery, the woman is making use of her vision. The vision was 100% restored.
I'm pledging.
Building a clinic in rural Africa takes more than just materials and money. You need the support of local community leaders, such as His Royal Highness Eze Ugorgi.
I am the traditional ruler of Ovim Autonomous Community.
Eze Ugorgi embraced the project and continues to support it to ensure the success of the clinic, which offers much needed health care to his subjects.
Ovim is right in the center of southeastern Nigeria, a community of about 25,000 people, most of whom are farmers. Malaria is a big problem in Nigeria. Some of the illnesses may be attributed to lack of this basic infrastructure of electricity, because after so much hard work in the farm, they come home, they want to rest. You can't lock your windows because you need air. If you open the windows, you're fighting with mosquitoes. Someone who is sick would have to be taken to Umuahia, which is about 1 hour driving from here. And then by the time you get there too, it doesn't even mean that you can be attended to immediately. You have to queue in line probably, because it's only a few hospitals. Therefore, before it gets to your turn, even if it's an emergency, we've seen cases where somebody who's bleeding is being asked to wait because of lack of beds, lack of doctors. The mere fact that you have brought a hospital right inside the community is a lot of blessing for the community.
One benchmark for success of the NAF project is the feedback of individuals that have been impacted by the work being done by NAF. The team had the rare opportunity to sit down and talk with one of the recipients of NAF scholarships, Jakude Kanu. Jakude is a 15-year-old boy from the village of Ovim. At first glance, Jakude looks and acts like any teenage boy. He enjoys playing with friends, attending school, and doing chores. However, each day is a struggle for this boy. He lost his father at an early age. His mother left him in the care of his grandparents, who were very old.
Before July 2003, he died. He died and left me, so I can't stay with my grandmother. Since that day, they have been struggling, fighting for me to eat, since I was small until now that I have grown. I thank God.
Chukwudi used to help me even to farm, to fetch water, to get firewood in the bush. Sometimes when I get something out selling, I can send him to go, and he will go eat. To wash our clothes, he used to try his best.
By sponsoring his education and providing him free health care, NEF has given Chikude a chance to change his future and to lead a healthy and productive life. Chikude is just one of millions of children in Africa that needs assistance. NEF has been a source of hope and opportunity for him and many others in Africa. But NEF cannot meet the needs of these children without your help and resources.